afternoon, Mrs. Stein. I'm Josh, I'm a student physio. How are you today?
I'm fine, you can call me Margaret.
Margaret, okay, we'll stick to that. So, like I said, I'm a physio here at the hospital, and you've been referred to us to come and see us about joining the Pulmonary Rehabilitation class. Now, this is an exercise programme which we'll be running each week that you are free to come along to. Now, your consultant and your GP have got through to us to say that they think you're going to be appropriate for this. And this is because recently I understand you've had a couple of problems with your condition. Is this right? You said in your notes that you get quite short breath when you're doing exercise or just walking to the shops and stuff.
Can't really walk very far, about 40 metres or so.
Yeah, and you think that's not what your normal is. It used to be a bit better than that. Okay. So another problem is we've seen that you've lost quite a bit of weight recently as well. You've suffered from that, and you've had a few chest infections. So the main aspect of the pulmonary rehabilitation is the exercise class, and this is going to benefit you because it's going to try and increase your exercise tolerance a bit. Now, I understand your husband helps you with quite a lot of stuff at the minute.
He does. I want him to stop helping me as much. I just feel bad.
So this will help get your independence back, take a bit off his shoulders, and it leaves him a bit, because I mean, if he's helping with a lot of things now that we can sort of rectify, so even if it's just working around the house and doing different things and being able to go out on your own, that would help a lot, and it gives you both a bit more time. It's quite good. I'm sure he doesn't mind helping you, but it might be a bit more beneficial if he does this. So as well, at the minute, we'd say you're in risk of becoming in a cycle of inactivity, which is where if you go out and you do exercise, or you do walk, or you do something that's got a bit of exertion, you might find that gets you very out of breath and gets your chest very tight and you don't like the sensation. Well, because of that, a lot of people can begin to get those symptoms and think, oh well, this is down to the exercise, so I won't exercise anymore. And because they leave that longer, the next time they try and do exercise, they can't do quite as much and they're still suffering. And this just sort of makes it even worse, because they can't do it again, they stop doing it, and then the breathlessness gets worse and it just keeps going and going and going. So we're trying to break that cycle now, do a bit of exercise and get you used to being a bit breathless again, and it should help increase your tolerance and increase your condition. Like you should be getting a bit better. Another thing is, you said your appetite's been going down recently. This is what the consultants told us. If you're not doing much exercise and you're sat around the house, then you're not going to be burning quite as much energy as you would do normally. So that might be why your appetite's gone down, and then why you're not eating quite as much. I mean, you can speak to the dietitians, they've been referred as well, they're going to tell you a bit more. But if you're doing this exercise class, it's going to use a bit more energy, and you're going to feel the want to eat a bit more, to get a bit more energy in. So that's another thing that can help benefit from this. So there's also aspects of the pulmonary rehabilitation. It's group exercise. There'll be a lot of other people. We have two groups running here at the hospital. So there's a group of mixed gender at the minute, or just female. It's up to you who you'd want to join. It's completely when it's available for you. And there are a lot of people who are in the same situation as you are. So they've all got sort of respiratory conditions or conditions with their chest, and they're all struggling, but they've all started this course, and then it's a way of sitting with people who are similar and seeing how they cope with the conditions, and a lot of them will show you how they have improved whilst they've been on the course, and it's a good progression, and they enjoy the social aspect of meeting up for an hour a week to talk about things and how they've changed after they started doing the course. So if you're interested, I'll tell you more about the course now. So do you think this is something you'd quite like to try?
Yeah, definitely.
Okay, so what today's session is going to include is, I've got some paperwork here, which is just some criteria you need to pass to sort of get on. It's just to check that you've not got any big contraindications and that you can. So there's things like whether you've had a cardiac arrest or anything like that, so any cardiac problems recently, or and it's just a paperwork we need to check off before we start. And then under this we have the depression scale, so we'll be going through that as well. We can do this. We've also got to do a 6-minute walk test. We'll do that at the end, and then we'll do the paperwork as well. We'll do that at the same time. So the 6-minute walk test is something we're going to do at the end, and we document that now. And then we'll take, again, at the end of your session, to the end of the programme, and we'll see if you've improved, and it's just a way of notifying that. Okay, so we'll go on to what PR will involve. So pulmonary rehab, you'll come into the session, there's usually about 10 to 15 people per session, and there'll be myself there and a physio assistant. So when you first come in, you'll sit around, and what we do is we take a SATS probe at the end of your finger, we check your oxygen levels, and we check your heart rate, and we'll document those on this piece of paper, and then you'll do a quick warm-up. Now the warm-up's probably going to be led by the assistant, And this is just gentle exercise to get you used to moving a bit more, get your muscles switched on and help ease you into it a bit. Because if you start exercise very quickly, it can sometimes cause some problems. So we'll go through that, and then I will come and sit down with you, and I'll take you through some exercises down here. And what we do is, well, I've lots of different exercises on here that you're going to try with my supervision at first, and then I'll tell you how to do it, give you a correct technique. And then later on, you'll notice from many of the other people in the session, you'll develop the ability to just go off and sort of do your own thing and sort of do the exercises when you want. So have you got any questions at the minute?
No.
Okay, so you've got arthritis in your knees, I'm aware. However, you know, that shouldn't be a problem when we're doing the exercises, but if you are having a bit of a bad day and you're having a bit of a flare-up maybe, we can alter the exercises and we'll include more arm-based things, so we can do bicep curls in the chair, or we can do pedals and stuff. We've got different equipment to cope with if you're not being able to use your legs as much. So you'll do the exercise, and then we record how long you've spent doing them and the amount of reps you've done, so the amount of times you've done the exercise, and then we take how breathless you are on the Borg scale. So this is another way of just us checking each week, like if you're improving, if you're not coping quite as well, and hopefully what we'll see is by the end of your 16th session is a significant increase from when you first started the programme to show that you've improved and you've got a bit stronger. So the aim of the exercise is to get a bit breathless. You are going to be out of breath. We don't want you completely knackered and panicking, but we do want you to be a bit out of breath so that you're working quite hard. So if we're doing, say, step-ups, for example, we want you to be at the point where you're starting to struggle a little bit, because that's the way that your body will adapt, and that will how you progress, and you'll get a bit better. So it's a good thing if you're getting a bit breathless. So there's me there, and there's the healthcare, and there's, you're in the hospital, it's going to be quite safe. And then there are drinks of water and things available as well. So we go through the exercises. That'll take about half an hour, maybe 40 minutes. So we'll do them, get them out of the way, and then we have a cool down, which is just some more gentle exercise to get you ease down. There's quite a lot of stretching, so your muscles aren't too tight the next day, and it won't affect sort of the days after you've been to the pulmonary rehab. You'll have 2 sessions a week, so they'll be spread out enough for you to recover between each session. It shouldn't be too much of a problem. And then the last 10 minutes of each session you usually spend doing a bit of education. So we'll take you through either breathing control, active cycle breathing, or we've been known to have relaxation techniques as well. So lots of ways of sitting back and just being able to relax. And this will help you manage your condition. As when you feel sort of a bit short of breath and you think you might be starting to have a bit of a panic or a bit of a flare-up, it'll just help you to relax and control it a bit more, and it might avoid sort of things becoming worse and worse if you can relax a bit. And then by the end of the course, you'll see other people who, because everyone's at different stages when we're at the course, not everybody starts at the same time and finishes. You'll see some patients who we refer on, and that's either to gyms or swimming pools or health centres or things near them, or a lot of people just choose to do exercise in their home. So it's about carrying on after we finish, but we can discuss more of them when you finish your sessions after the end. So have you got any questions for me?
No, that was all really helpful.
Okay, that's right, good. So what we'll do now is we'll get up and we'll go out and we'll try your 6-minute walk test now. So if you just like to get up, and we'll go.